Liposuction is the aspiration of fat from an unwanted area to improve contour. It is not a weight loss mechanism, so patients who desire weight loss, this is not for them. But it is a way to contour the body in very specific areas. And the most common areas are from head to toe, under the neck, the chest, particularly in men, the back rolls, belly, flanks, lower back, thighs, and sometimes even the knees, believe it or not. Step one for liposuction is infiltrating the area with a solution that reduces pain and bleeding. The second step of liposuction, depending on the technique, is either using a vaser, which helps melt the fat, or liposuction itself with a cannula. Traditional liposuction after the tumescent is when we get a cannula and attach it to a negative pressure and suck out fat, basically. The procedure itself doesn't hurt naturally if one is asleep, but also if we tumescent the area appropriately with numbing medication. It can be done actually with the patient very comfortable while they're awake. Afterwards, it does hurt. And it's one of the procedures that probably hurts the most, actually, in the scheme of different procedures. Pain will probably last a few days. There could be significant bruising and swelling that can persist for months, which is why it's imperative that patients stay wrapped and compliant with the wraps to both create a nice uniform distribution of pressure to improve symmetrical contour and reduce swelling for quicker recovery. The right candidate gets fantastic results. The wrong candidate gets terrible results. And that's the biggest problem with liposuction, is determining the right person. And in my feeling, I think it's overdone in a lot of patients. And one of the things we have to consider in evaluating who's the appropriate candidate is, one, have they been weight stable? And if they haven't been weight stable in 6 months, if they're fluctuating up and down, their outcome is going to be suboptimal. Two, if they are weight stable, what is their weight? While there's no magic number or BMI, generally people that are really overweight benefit less from liposuction and should probably try to lose weight first before we contour, because this is not a global aspiration of fat. This is very localized for contour correction and enhancement. And the other thing is skin laxity, and this is the big problem. If men and women have very loose skin in certain areas, the medial thigh being one of them that's notorious for doing terribly with liposuction, then they're going to have a bad outcome with loose skin, irregularities, and that sort of thing. So I think the diagnosis, which is, who is the appropriate candidate, is probably the most important thing in liposuction. Of course, second, the technique.